Hey everyone, and today we're talking about a topic that's close to the hearts of many pregnancy. Bringing a new life into the world is an incredible experience, but it's also important to be informed about potential complications. While most pregnancies proceed smoothly, there are some warning signs that should never be ignored. So whether you're an expectant mom, a supportive partner, or just someone who wants to be informed, stick around because we're diving into 10 critical pregnancy warning signs that warrant immediate medical attention. Remember, it's always better to err on the side of caution when it comes to your health and the well-being of your baby. Let's start with a symptom that's hard to ignore: severe abdominal pain. We're not talking about mild discomfort here, but rather intense, persistent pain that leaves you feeling like something is seriously wrong. This could be a sign of a condition called preeclampsia, a dangerous pregnancy complication characterized by high blood pressure and organ damage. Another possibility is placental abruption, where the placenta detaches from the uterine wall, cutting off oxygen and nutrients to your baby. If you experience sudden severe abdominal pain, especially if it's accompanied by vaginal bleeding, don't hesitate. Spotting during pregnancy can be normal, especially in the first trimester. However, heavy bleeding is a different story. This is bleeding that's similar to or heavier than your period, and requires immediate medical attention. Heavy bleeding could indicate a miscarriage, particularly in the early stages of pregnancy, or it could signal problems with the placenta later on. It's important to remember that every pregnancy is different, and what's considered heavy bleeding can vary. If you experience bleeding that's soaking through a pad an hour, accompanied by cramps or abdominal pain, or if you're passing large clots, don't wait. Headaches are common during pregnancy, especially in the first and third trimesters. Hormonal changes, increased blood volume, and even stress can trigger headaches. However, a severe headache that's persistent, throbbing, and doesn't respond to over-the-counter pain relievers is a red flag. This type of headache could be a sign of preeclampsia, especially if it's accompanied by other symptoms like vision changes, nausea, or swelling. Blurry vision during pregnancy isn't always a cause for alarm. Hormonal changes can affect your eyes, and even fatigue can lead to temporary blurriness. However, sudden blurred vision, double vision, seeing flashing lights, or loss of vision, especially if accompanied by a headache, can be a sign of preeclampsia. Remember, preeclampsia is a serious condition that requires immediate medical attention. Some swelling, especially in the feet and ankles, is normal during pregnancy as your body retains more fluid. However, sudden or excessive swelling, particularly in your hands, face, or around your eyes, can be a sign of preeclampsia. This is because preeclampsia can cause fluid to build up in your tissues, leading to swelling. Your baby's movements are a reassuring sign that everything is progressing as it should. While every baby has their own activity pattern, a significant decrease in fetal movement can be a sign that something is wrong. It's crucial to be aware of your baby's normal movement patterns and to trust your instincts. If you notice a sudden or significant decrease in movement, don't hesitate to contact your healthcare provider. Chapter 7. High fever, don't wait it out. A fever during pregnancy is never something to ignore. While a low-grade fever might not be a cause for major concern, a high fever, especially if it's over 100.4 degrees Fahrenheit or 38 degrees Celsius, can be dangerous for both you and your baby. A high fever can be a sign of an infection, which can lead to complications like preterm labor. Morning sickness is a common and usually harmless pregnancy symptom, but severe nausea and vomiting that prevents you from keeping any food or liquids down is a cause for concern. This condition, known as hyperemesis gravidarum, can lead to dehydration, electrolyte imbalances, and weight loss, which can affect your baby's growth and development. Frequent urination is common during pregnancy, but painful urination is a different story. Pain or burning during urination can be a sign of a urinary tract infection, which is more common during pregnancy. If left untreated, a urinary tract infection can travel to the kidneys, leading to a more serious infection that could harm both you and your baby. As your pregnancy progresses and your baby grows, you might experience some mild shortness of breath as your lungs have less space to expand. However, sudden or severe shortness of breath, especially if it's accompanied by chest pain, rapid heartbeat, or bluish lips or fingertips, is a medical emergency. This could be a sign of a blood clot in the lungs, a serious condition that requires immediate medical attention. Pregnancy can be an amazing journey, but it's crucial to be aware of the potential complications. By knowing the warning signs and seeking prompt medical attention when necessary, you're taking a proactive step towards ensuring a healthy pregnancy for both you and your baby. Remember, your health and your baby's health are the top priorities. Don't hesitate to reach out to your healthcare provider if you have any concerns, no matter how small they may seem. Stay informed, stay vigilant, and have a happy and healthy pregnancy. Always trust your instincts and don't hesitate to contact your healthcare provider if you experience any of these signs. Your health and your baby's health are the top priority.